Okay, we'll start our program. First,
حتى كتير البروجكتور شغال طفى الانوار.
لا بمشي اتكلم عن البروجكتور. Good morning again. We'll start our program, which is endorsement by the use of Sbar. Sbar is new tool. It's not new in everywhere. It's just in our hospital. It's going to be new, and we are going to use it as the communication tool, which by endorsement and the use when we are referring a case to a doctor. The program today it includes documentation, medication transcribing, and other, and the use of Sbar. It's 2 lectures and patient education. This all the topics are very important for us in King Fahd Hospital and all King Fahd Hospital staff. It's really important for you because we are using, we having competencies. And you know already we started last month our competencies for the assessment, reassessment, right? Okay, that's very important, the lecture. When you wanted to answer the competencies, the questions coming by CRN in the department, it's very important, please focus. And if you have any question, and if you need me to translate, الأخوات اللي يبغوني أتكلم بالعربي أي نقاط, you just ask me and I will translate it at any time. Last month we started this assessment, reassessment competency, okay, and we are about to finish. This month we have 2 competencies about the documentation and the use of Sbar. This for our King Fahd Hospital, it's mandatory, and for others, if you think it is useful for you at any point, you will be having it, or I will be giving you at the end of today. And if you want to use it at any point in your hospital, you can use it, or BHC. Okay? First, and in my lectures, and any point is all the answers of the competency. And again, for our colleague from different hospitals and from BHCs, when you came, the competencies to be used, it is not for the for just to say that you are good nurse or you are bad nurse. I said that one to King Fahd Hospital staff, and again, I'm saying it to you all. Competencies not to be used to judge you are good or bad. Competencies to be used to say what educational points or what education do you need. الكومبتنسيز استخداماتها ما هي للحكم ان نقول انكم كويسين او انكم سيئين. Competency to be used only for education, يعني نستخدمها لإيجاد النقاط اللي نحتاج نسوي فيها education وتعليم أفضل. Okay? Essential elements of accurate documentation. In my presentation, I will be talking about documentation. I'm not going to say what tool to be used as nurse's note or what assessment forms. No. When I say documentation, I will be talking about what are the elements, what are the things you should include in your, or just like character of your documentation. And we'll be talking about the grammar, spelling, and the other policies to be included. Okay? Introduction. When I say this documentation means, can anybody tell me what are the documentation you are doing in your hospital? Our King Fahd Hospital also? What documentation you do? Nurse's note? Medication? Vital signs? What else? What documentation you do? For risk? It's a documentation. So, documentation includes every paper in patient's file or document that you put in patient's file, it is documentation. Okay? And documentation here maybe also include that you are documenting via writing, handwriting, via computer, via recording. So it's all documentation. So it's either handwritten, electronically, or audio. Maybe in the future we will have full or total patient medical, this electronic medical record. So we will be documenting via computers only. It is a communication. So when you do documentation, what is the main point? Why you are doing whatever documentation you do? Why? For easy communication with other healthcare workers, those coming for the next shift, for the doctors, for the for for researchers when they come to do some research about the hospital. So it is very easy to communicate. I'll give you one example. When you are talking on your phone, mobile phone, sometimes the signal is not good, right? What will you do? You will go another place to find good signal, right? Okay, this is the way. Communication, when you do it wrong way, nobody will hear you from other side. Nobody will understand you from the other side. So you have to make your documentation properly and eligibly. So by good grammar, good spelling, and by the right policy of the hospital, so you will communicate properly with the next shift or next people. It's not optional practice. It's not something you may do or you may not do. Something it is must. And we know you have shortage of nurses. You have work overload. You work in the evening and night, only 2 nurses, and you have so many documents you have to fill. But sorry, documentation it's mandatory and it is legal. It's something it's legal, and maybe they will call you at any time for investigation. So if you do proper documentation, that means you do proper nursing care. Remember I said if you don't document, that means not done. Even you are doing so many things, and at the end you are not making any documents in your patient's file, that means you are not doing it. Even you did everything, but you forget to document, it is not. It's an evidence of practice. Again, as I said, it's not written, it's not done. High quality of documentation will help you to give skilled nursing care. So if you show that you know how to do your nursing documentation, nursing note, that means you do really good nursing care, because you are documenting everything you are doing. That means if sometimes some staff, I'm not saying you are or others, I don't know, but if we will not find any document we will find for the shift they are writing, received patient on bed, endorsed patient. So what do you think you did? You are not doing anything in the night. You are not doing anything in the evening or even in the morning. We know sometimes chronic patients they are staying for a very long time in your department and nothing to be done, only feeding like that. So it is feeding. And in the morning, when you are going to your patient, when you have the endorsement, right? Then you will go to your patient and you will just look, right? You just look only to your patient. This is assessment. You do vital signs, this is assessment. So you have to give whatever the outcome of your assessment. And the assessment, we will have one lecture about that. Assessment and reassessment to be done, so you will know what are the changes of your patient's condition, right? So still you are doing things in your department, but you are not documenting maybe. So you are not doing any work. If I come to read your patient nurse's note and I find there is nothing, no documents made, no writing, so I say maybe you are not doing your job. Maybe you are very hardly doing your job, but you are not writing. Again, the purpose of the documentation, it is to help communicate with others, to promote good nursing care, to help quality improvement. How is the quality improvement? Why we are sometimes, just saw some nursing, if we will ask, for example, the quality department, they are asking a copy of the nurse's note, for example, or we are in nursing service, we will ask for your patient file. It's not only for investigation. Sometimes we need to review. When we come to make round in the department, either in our hospital or other hospitals by regional nursing office, they will come, they will just look to the files. It doesn't mean they are coming to make problems for you. Definitely they are coming for some reason. They are coming maybe to improve your work. How they will improve? They will read. When they will read nurse's note, they will find some problems, then they will just find the way to improve you. So it is for quality improvement, to help in research. We are very, very, very bad. We are not really, we are very behind. We did not do any research. There are no nursing research in the kingdom. Rarely you will find people coming to do research. But nursing documentation is really important for the research, like how to improve by research. It's not only by numbers or like that. So people, they need to, if there are some researchers, they need to come in your department to open patient's file just to look for the information. To make professional standards, so we have standards of care in the hospital, and I'm sure in your hospital you have it, or your BHC, so you need to meet the standards of the hospital. Legal standards. So we have legal standards, we'll talk about it later. And it is one of the competency questions. What are the legal standards, what are the legal points of your nursing documentation? So what are the things you needed for your documentation? To plan effectively future care. Okay, when we do documentation, and especially when we make the timing, right? Sometimes we need to write, receive the patient, okay, you have to mention, for example, I received patient with Foley's catheter, I received patient with NGT, I received patient, but it's not only like that, you have to write like NGT, it's patent, so you will give full information. And when you give full information and we found out, for example, you came 7 o'clock and you make your nurse's note, and by 8 or 9, the patient removed the NGT, for example. So next time, by 10 o'clock, you inserted again the NGT, and then patient removed, right? So next time when you go, and you have more than 5 patients, and when you find like, okay, this patient you will forget. Sometimes, and I'm sure we are forgetting, and we are just human beings. And when we forget what we have done for this patient, the only way to find out is by the nurse's documentation. What we documented at the beginning, then we will just see. Okay, we documented like this: patient removed the NGT at 7 a.m. or 8 a.m. and then inserted again patient removed. So why is like that? When you plan your care, you have to ask yourself why this patient is doing that. Is it because the patient aggressive? Restless? Is it because the patient family, they think it's not good to have more tubes in the patient, in their patient, or what? So you will plan. If the patient is restless, what we have to do? We plan the next care. So we plan for the restraint. So you will call your doctor to do the restraint. So you are planning the next thing to be done for your patient. If the family, they will ask you to remove because too much of tubes, then what we have to plan, next plan? What to do?
Education.
Okay, exactly. You have to do family education. So it is important, everything you do with your patient, if you don't document, you will forget. And then you will not be able to do proper planning for the future care. It is a permanent record. It is not something you will write and you know it will be gone. No. Whatever you document, it is documented. And you have no authority or no right to remove any document from the patient file, because it's already there and it plans even for the future of the patient. Sometimes we have investigation, if patient, maybe the family complain, that record, it's your evidence that you did your best care for your patient. So when you do a better recording and better documentation, then your patients, the relative, if they are complaining, you are sure. So it's okay, they will look. But if you don't do, so how they will find out that you are doing good care? They will never find out. And if you will say like, okay, there is a patient for investigation, then we know sometimes, or some nurses, they did some mistakes, or not even nurses, some other discipline, they did some mistakes in the documentation. And it is, as I said, it's permanent record and it is legal. So they have no right, or you have no right, or nobody have the right to come and rewrite in the nurse's note or in their note or whatever. Because it is legal and they will change the information, they will change so many things. And we'll talk later about the policy of keeping space and correction. أحمد غير كله فهم بيت Nursing documentation must provide an accurate and honest information what event occurred. What are the types of documentation we said at the beginning? Nurse's note, patient assessment, medication sheet, vital signs, pain assessment, fall assessment. It's all different types. Cardiacs, all different types, and patient family education as well. Physical patient and family education, nutritional assessment, wound assessment, intake output. It's all nurse's note. So, how to make a good documentation? So first, you have to describe all events objectively. So when we say objectively, what is the meaning of objective information? What's the meaning for objective information? إيش يعني نقول لازم تكتب objective؟ ما هو subjective؟ ها؟
What we have observed we are documenting.
Okay, so objectively mean from what you observe, what you assess. Okay, subjective. What the patient is complaining. So when we say assessment, you do the assessment, right? Assessment, subjective information. Patient complaining of low back pain, right? So this is subjective. So what objective information you will get from here? How will you do the objective?
Patient's condition.
What's that?
Patient's condition.
Patient's condition. What do you mean by patient? Okay. What is the objective information here? Okay, exactly. You will check the patient. If subjective mean, you will ask the patient what is the problem. When the patient will call you, sister, I have pain. Okay. Then you will go and assess. You will see what is the pain with the patient. Then you will turn, for example, low back pain. So you will turn your patient and you will check at the back. If there is any swelling, if there is redness, there is deformity. So you will know what is the assessment and what are the things you are writing. If the patient is complaining of difficulty in breathing, this is subjective, right? This is subjective. So I will tell you I cannot breathe, I am suffocating. So what is the objective expected here? Respiration rate, oxygen saturation. So it is important. This is the way you will do objective information. So when we do documentation, we have to understand the subjective and objective. And every time you are going to check your patient and you do assessment, don't look for the subjective. You are very busy again. You are in the counter, you are 2 nurses with 25 patients or 20 patients, but still you have to go and check your patient. And you know all the time your patient, they are calling you, I have pain, I am difficulty in breathing or whatever. Still you have to go back to your patient and check what is the condition. So how they feel. What are the changes in the body of the patient. So you will know. You will collect good information to make the nurse's note and to call your doctor. Anyway. أيوه. Don't use unclear terms. So don't use, like, for example, you will see, okay, the patient eats good amount of food. What is good amount of food? Maybe it's good for you, but it's not good for the patient. Maybe it's too much for the patient already. Don't say patient pass urine, good amount of urine. Patient had the food, had this enough NGT. What is enough for you, it's not enough for the patient. Or maybe it is too much for the patient. So don't use such terms when you are doing your documentation or even assessment for your patient. When you have to include subjective information, you must include what patient have said only and exactly. So when the patient is complaining of pain, for example, So you have to write, for example, patient told you أنا في ألم في رجلي كثير, or أنا في ألم كثير في رجلي مثلا what? Say it's like sharp pain, and you know the patient has given you long phrase, but it is subjective information, so you have to write exactly what the patient told you. So you put into like this, I don't know what's that in English. Yeah, so you will write patient said like this, like this, like this, exactly. So this is the subjective information you are writing from the patient. Yes. Write it exactly. You will not write in Arabic letters, in English letters, but what this is Arabic pronunciation. This is in Arabic pronunciation. You are Arabic, but others non-Saudi they cannot write. Exact measurement and amount. So when the patient giving you you are checking the output, you will write exact amount again. You will write, for example, 400 ml via suprapubic catheter or Foley's catheter. Patient have this 400 ml of NGT feeding, so you will write via NGT. Again, don't write good intake or output or good output. Write it, for example, 400 ml via NGT. Complete. When we say complete, sometimes we studied in nursing schools, we studied nurses' note according to what they said in the school. But sometimes in the hospital, we have, for example, our hospital policy here. Nurses' note we will write for our nurses, King Fahd Hospital nurses. What is the date and timing? What we are using date and timing here in King Fahd? We have to write English and Arabic date. And then timing, it's military timing. So this is our hospital policy. Maybe in your hospital you are using 12 hours, like 1 to 12. So you have to write 1 or 2 or 3 or 4 or 12 p.m. 12 p.m. or a.m. So according to your hospital policy. So we studied in nursing, one date, time, and your signature, right? But here in the hospital we have to write in 2 dates, Arabic and English, and we write the military time. So this is called complete nurse's note. Be sure you apply hospital policies and procedure and documentation. Sometimes the hospital policy that you will write Sbar, it's not just for the documentation. Maybe you have to use ifdar. So whatever the maybe just narrative. So you will write a story. So whatever the policy of your hospital, you have to follow. Condition changes. So you have to mention whatever conditions your patient, or there's any changes in emergencies for your patient. So you have to write. Patients respond if you do any assessment. So at the end, we'll just see we are doing this nursing process, like assessment and whatever the response of the patient at the end. Use all forms. All the forms. You have like 10 forms to be used. You have to use it. You have patient education form, you have nursing note, whatever the form, so it's important and it is legal again. Timely. Use the date and time as per hospital policy. And why we are using military time? Why it is important? Or why we are not using 12 hours? Why it is important? And this is one question also on the competency. Why we are using military timing? Is it because they wanted to be fancy and like Western people only? What's that? Error. So it is because to prevent error. What do you mean by error? الأخطاء تحصل. We are not using PM and AM here. So if you will write, you did some procedure at 2, and you forget to write PM or AM. So it will be a mistake, right? So this is a mistake at the end. So we have to write military time according to our hospital policy, and we have to write 0200. So it's 200 hours, 24. So for us, is it 0000 for 12 midnight? Or what, 2400? So 2400 means 2400. Okay, so this is the policy. That's the time we have to write. Each entry happened in different time must include exact time and date. So if you have, for example, you make your nurse's note, and then you forget something to write. What is the policy? What do we have? So it's late entry. This is our hospital policy, is late entry. We have to write it and to mention it is late entry. Right? Okay. Avoid advanced recording. Do not do advanced recording and whatsoever, under whatever conditions. Do not write things not yet done. You are planning to do something and you will write it ahead. No, this is not the right way. And this is, maybe you will die, maybe there's something else will happen to you, or maybe you will be busy with other patients, so you will not really do it, and you will forget. Next shift will come, they will think you did it. So, this is not the right way. Medication administration. What is the policy in our hospital? Patient identification. And actually the 5 rights of giving medication. Remember? Right patient, right dose, right medication, right route, right frequency. Okay, when you wanted to apply these 5 rights only, it is 10 rights becoming 10 or something. So if, for example, only the 5 rights you wanted to apply, how will you apply it? How we should apply this one? How can we do it? Take the patient file, prepare the medication. When you prepare the medication, you have to look exact medication. You will hold the vial, or you will hold the box or the strip, right? Then you will check the name of the medication. You will check the strength of the medication. Okay? So you will know. And then you will check in your medication file. You will see whatever the exact frequency, or the route. So you will check. Maybe it's written IM. Okay, and we have the tablets. It's not only we see Voltaren, for example. We have to look Voltaren. It's once a day, twice a day, whatever. And then the timing, and then the route. So we will be sure that it's exact medication. Okay, now you prepare the medication. How will you apply the right patient? You check. Yeah, the 2 identifiers, patient record number and the name. And we use the name, first 3 names.
First 3 names.
Okay, so how will you achieve this right? Will you suppose, or you have to do sign the form or the medication sheet and keep it at the counter, then you will take the medication?
No.
I know my patient, right?
No.
Maybe we'll say, okay, I know my patient. This patient with me 5 years, 4 years, 3 years.
No.
So we'll just take the medication cup and we'll go there?
No.
This is not the right way. What do we have to do?
Medication sheet along
Medication sheet. And then?
medication sheet along with medication bed and patient data.
Okay, so you will go in patient bed and then you will be checking that patient, if he is the right patient or not. Even though you are aware that's your patient for a long time, but mistakes happen. We are human and we are forgetting. So this is how will you apply the 5 rights or 6 rights or 10 rights. So this is very important. Maybe sometimes we hear some stories that some nurses, they are signing the medication sheet and keeping that one. Yes, you are busy, you are having many patients, but still, please do it this way. Take the medication sheet. When you are giving the medication, you check your patient. Check him right or her rightly. Do it as soon as possible. Concise, make it simple. Maybe you know English very well. Please don't write too much story. It's not relevant to your patient. Make it simple, make it easy, make it simple language. Just go direct, but be accurate. Do not write non-necessary things. Okay, comes the guy. 2 minutes, man. Make it brief. Save time, but be accurate. Legible, use black or blue pen. Why we are not using red? Green?
We cannot have the copy.
If legal department they want copy of your documents, you cannot do it because cannot be copied. Do not leave blank spaces. What is the policy of if there is space? We have to cross and write space. Okay. Why it's like that? Maybe anybody can add anything and then it will be under your name. Name and signature, use approved abbreviation. Name and signature, when we say signature, do not just make 2 lines or 3 lines like that. This is not the way. You have to write your name clearly. Your name. So when someone will come and they will know who did this documentation. Approved abbreviation. Why we have to do it? Because sometimes people coming from India, from Philippines, from Pakistan, from Saudi, they use their own abbreviation in their country, although it is internationally accepted. But the one from India, maybe they have their own, and they use it. For example, see, complain of, it's different abbreviation, and in Philippines different, in Saudi different. So there will be confusion and there will be mistakes. What should be avoided? Errors in charting, unapproved terminology, late entries, and in conclusion, documentation is an important part of your practice. It is not optional. Follow your policies procedure. Remember and record, consider not done. If not recorded, not written, not done. Okay, this is the first presentation finished. Thank you. And by the way, so this CME hours, it will be accredited, but not yet. It's under process. So don't worry, inshallah it will be recorded. Okay? The second thing, we will finish early. Don't worry, but please, lunch break, breakfast break, come on time. If you will be late, that means we will be late. يعني تعالوا في الوقت على أساس نخلص بدري.
السلام عليكم ورحمة الله. السلام عليكم ورحمة الله. الشباب.
بسم الله الرحمن الرحيم. بسم الله الرحمن الرحيم. اشتراكات جديدة وعلوم جديدة نبدأها في مستشفى الملك فهد المركزي في جازان، وهذا البرنامج الذي يعنى بتسليم الحالات بين التمريض بطريقة سبار. سعادة المشرف العام على مستشفى الملك فهد المركزي في جازان دكتور حسن الشعبي، سعادة الأستاذ جبريل مهاجر مدير إدارة التدريب بصحة جازان، سعادة الأستاذ موسى النخيفي مدير إدارة التمريض بصحة جازان، أيها الأخوة والأخوات المشاركون في هذا البرنامج. كلمة بهذه المناسبة لمدير إدارة التمريض بمستشفى الملك فهد الأستاذ عبد الرحمن العامي.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين والصلاة والسلام على أشرف الأنبياء والمرسلين. أصالة عن نفسي ونيابة عن زملائي الممرضين وممرضات مستشفى الملك فهد، أرحب بكم في هذا البرنامج. التمريض عنصر أساسي وعنصر مهم في المستشفى، ونحن مركزين بصفة خصوصية على التمريض. لا أطيل عليكم، شكر موصول لكل شخص داعي لهذا البرنامج، والسلام عليكم ورحمة الله وبركاته.
نستمع إلى كلمة توجيهية من الأستاذ موسى النخيفي عليه الرحمة.
السلام عليكم ورحمة الله. بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا وحبيبنا محمد بن عبد الله عليه وعلى آله وصحبه أفضل الصلاة وأتم التسليم. صلوا عليه. أولا سعادة المشرف العام الدكتور حسن الشعبي، سعادة مدير إدارة التدريب صحة جازان أستاذ جبريل مهاجر، الزملاء من الممرضين والممرضات اللي حضروا هذه الدورة. أنا اليوم أقف هنا ممثلا لإدارة التمريض بالمنطقة، وليس ممثلا لمنصبي في مستشفى الملك فهد كمدير التمريض، لأن هذا البرنامج هو جهد الزملاء بالكامل، لم أتدخل فيه بأي جهد من إدارة التمريض حتى. وهذا يحتسب للزملاء من يعملون في إدارة تنفيذ مستشفى الملك فهد باستقطاب أكثر من 70 مشارك من المستشفيات الطبية. هذا شيء يعني مشرف وشيء رائع وعمل يعني يشكرون عليه. الشيء الثاني، أنا كنت سعيد جدا إنه أصبح في شخص في إدارة تمريض مستشفى الملك فهد حمل العبء عني، وهو عبد الرحمن العامل. وهذه حقيقة حببت إني أقولها أمام الجميع، لأنه ليس عيب أبدا إنه يصبح عندنا شباب وجيل جديد يحمل الراية. حقيقة أنا سعيد جدا بهذا. كذلك شكر موصول للدكتور حسن اللي اختاروا انه يكون نائب لمدير التمريض المستشفى الملك فهد، انه الدكتور حسن عنده استراتيجيات معينه يعمل عليها من سنوات. كل ابناء مستشفى الملك فهد تقريبا اختار عدد كبير منهم يعملوا في المديريه، ونحن صنيعه الدكتور حسن. هذه حقيقه واقعه دفع بنا الى شده العمل في المديريه وتحمل اعباء كبيره، وهو يعرف جيدا الاعباء اللي بنتحملها في المديريه. لذلك الدكتور حسن هو راعي وداعم دائما وابدا للتمرين، وبصفه خاصه يعني لجميع من يعمل في اداره التمرين. لذلك اليوم احنا امام برنامج مهم جدا جدا، هو تسليم الحالات. تسليم الحالات بنعاني منه في جميع المستشفيات، ومستشفى الملك فهد هو ركيزة أساسية لأخذكم إلى المعرفة الحقيقية. هذا البرنامج إذا أخذناه بجدية وطبقناه على الواقع وليس ساعات وشهادة وريجستريشن وفي النهاية لا تطبيق، هذه مشكلة كبيرة جدا. لذلك أتمنى كل معلومة تأخذوها من زميلنا أستاذ شوقي، هو يعني يعتبر بنك المعرفة عندنا في مستشفى الملك فهد. كذلك جميع الزملاء المشاركين كمحاضرين، أتمنى أن تأخذوا هذه المعرفة وتطبقوها على الواقع. لا أريد أن أطيل، شكر موصول لكم جميعا لحضوركم ولتشريف الدكتور حسن وحضوره وإصراره على التواجد، والشكر لكم جميعا ايضا لمدير اداره التدريب بالمنطقه الداعم الاول لاي برنامج تدريبي في المنطقه. السلام عليكم ورحمه الله وبركاته.
فعلا الداعم الوحيد لجميع البرامج المستشفى وحرصه الشديد على راحه المرضى في كل وقت وكل حين. كلمه لسعاده المشرف العام الدكتور حسن الشعبي، فليتفضل.
السلام عليكم ورحمة الله وبركاته. Can we speak in English or Arabic? English. Good morning, everybody. It is a pleasure to be with you today in one of the activities of the special department in the hospital, the nursing department. First of all, we would like to welcome Mr. Jibril and Mr. Musa and all other colleagues who are coming from outside the hospital to join this program, the Sbar, situation background assessment and recommendation. This program, which is initiated by an idea from Shawki and Abdurrahman, and it is a very, very important subject to handle the cases, to document properly, and to follow your patient properly. This is one of the standards of the JCI, as you remember, and Sbar also. And today we are applying our mission in the hospital. I'm sure most of you know the mission of our hospital. The mission of our hospital is to, we are the leaders of healthcare services in the area. So by this program, you prove that you are the leaders because you are documenting the best all over the area. And we are teaching now others how to document, because whatever effort you do with the patients, if not documented and not handed to the next team, it is nothing, isn't it? And patient may go into sentinel events or a lot of communications, so safety will not be there. So this is very important now, and you have to be proud that we are doing this program by our own people, and you are here to teach others even, and to teach those who did not attend the program. This is one of the most important issues and tools in your hands to do it as nurses. And I emphasize on using this program as electronic also, to document electronically. Until now, I think, Abdurrahman, still not yet there. Documentation in the electronic.
No, still, we're going to start with.
Yeah. We have to go for this step. We have to go for electronic documentation. You know, now we are using A5 for about 5 years. So it is time to use the electronic documentation. Believe me, it will be difficult in the beginning, but later on it will be very easy. And why electronic? Electronic is 100% documentation is there. Timing is 100% professional, and it will be spared and saved for long life. Okay? And at the end of the time, or at the end of the day, it is very, very easy. It will be very easy if you use the electronics, because we have a lot of modalities we want to introduce in the hospital to use the electronic medical records, either dictation or using the recorder, or using the electronic pen even. You can write electronic pen. So we just want a trigger from you as nurses to start. We will help you out. I hope if we arrange a program, where is Chogi, for this to document electronically nurses. It will be difficult in the beginning, but later on it will be the easiest. It will be more easier than handwriting. Okay? Agreed?
Yes.
So, I'm working a program. I will support this program 100%. I'm sure Jibril will support also this program 100%. Because now in the big hospitals, like our hospital, they use 90% electronic documentation. So inside the room with the patient, you have a computer, you can register everything you want. They connect the vital signs monitor wireless to the computer. So you just get the monitor connected to the patient arm. Electronically it will go. You don't need to write or to rewrite again. Because now what you are doing, you are taking the measurement, writing in a small paper, and then going, you may forget, you may. Some people, they may not do it, and they just write. We hear this, unfortunately. But like this, you are documenting 100% correct results. It will go smooth. What you need to do is only to connect the monitor and to make sure that the reading is there. Wireless, it will go to the computer and to be registered. So it will be easy for you. Okay? Anyway, this is one step. I hope, or I wish if we have a program like this in the near future, inshallah. And we are supporting, and here Jibril, I'm sure he will support. Okay, Jibril?
Inshallah.
Okay. I like to thank all people who are speaking in this session. Mr. Larissa, Brother Abdurrahman, Brother Shawki, Musa, maybe other colleagues, I forget their names. Rizalin, yes. And I would like also to thank the training department, the public communication department, for this evolution of gifts and preparation for the last 1 week I saw them. It is a pleasure again to be with you. Enjoy your session, and I hope we will see this practically applied in the filing system, inshallah. Thank you very much again. Thank you for everybody attending this course. Thank you for all those who are helping and supporting this program. Thank you very much.
شكرا دكتور حسن. الآن هناك ناس تميزوا وهناك ناس يستحقون التكريم. نبدأ مع الأخ زوجي.
دكتور حسن.
موسى.
اولا درع الشكر وتقدير لاداره التدريب والابتعاث بصحه جازان ممثله في الاستاذ جبريل مهاجر لدعمهم البرامج التدريبيه التمريضيه وللمستشفى كامل.
موسى عبد الرحمن هذه هديه منك كمان.
هنا ممكن.
اولا لدعمه البرنامج كممرض وهو الاب الروحي الحقيقي لهذا البرنامج، وثانيا لجهوده في جميع الاقسام وتوفير المستلزمات الطبيه في جميع الاوقات الاستاذ هيثم مشرقي.
حتى جيد طبعا
دائما الاول يعني درس كل البرامج دائما.
إذا احتجناه للتمويل كان حاضرا، إذا احتجناه لأشياء تخص إدارة التمريض كان أول مساعدين أحمد زعقان.
تواجد يعني على مدار ال 24 ساعة بصراحة يعني.
تعال عبد الرحمن غير
لجهدها الواضح في إدارة التمريض وبكل هدوء وشفافية شكر وتقدير للأستاذ نوير عبد الله.
اليد اليمنى لي دائما يعني
طبعا ما يحتاج
ما استغني عن دعمها دائما. تواجد على
ناخذ صور ولا ما يحتاج؟ خلاص حسين ما في صور.
لعملها الجبار لإنجاح الكثير من الأنشطة وتكفلها بالكثير من الأعباء المالية، وصراحة هي تعبانة اليوم ما قدرت تجي الأستاذة فاطمة غبير.
نيابة عن
صور ضروري عشان نبنى الصحيح.
الجندية خلف الكواليس بقسم تدريب التمريض الأستاذة أميرة مدخلي. وأيضا نبارك لها قبول
الدراسة وداعمة يعني
لتغطيته العمل في كثير من الأوقات الصعبة وعمله بكل احترافية وتواجده في جميع الأوقات الأستاذ ماجد حامد من الطوارئ.
رجل اكتف يعني يجي حتى في غير الديوتي دائما.
ماجد محتاج.
لجهده الكبير في العمل، وأيضا أول من يساعد في أي عمل يوكل له بكل سرعة وتميز الأستاذ سليمان أزواني.
هذا القلب برنامج بالمستشفى يعني.
طبعا سليمان ما يحتاج.
الأستاذ عاصم المنقري لتعاونه الكبير في التنسيق لهذا البرنامج على مستوى المنطقة.
خلك دائما أحلى من
هذه تقدم الصورة. هذه الصورة.
العلاقات العامة على رأسه محمد العامري ولجهوده في وضع اللمسات السحرية على هذا البرنامج.
أكيد.
محمد ترتيبات يعني حتى توصل
المتميزين من الأقسام من العناية المركزة أحمد علي واصلي. ميل سيرجيكال هرتينا. وين هرتينا؟ كم؟ فيميل سيرجيكال من الجراحة النساء رعنا أحمد. شيكين from girls Yasmi Thomas. From DR Sister Belinda Velas. Obi Princess Permas. Where's Princess?
Oh, Linda, we have to take picture. We have to take picture.
From Gani, Kunjumon. From Neonatal ICU, Mariam Ali Sabhi. Neurosurgery, Ahmed Muhammad Shayban. لظروف خاصة ما كان موجود اليوم. العظام رجال عيسى يحيى البيبي. كنجي
من اللي بعد؟
عبده يستلم على أحمد شيبان. أحمد شيبان مو برنس.
خلاص طيب هذا خارج.
عيسى البيبي للعظام رجال. العظام نساء ليلى أحمد سلامي.
بعدين خارج بعدين
ليلى سلامي العظام نساء.
شكرا ليلى من الناس اللي
الباطنة رجال سلطان عجيبي. الباطنة نساء. الباطنة نساء نعمة إبراهيم عيدي.
اليوم اشتكت من العيان.
العزل ايزوليشن ماري بيك أنتون.
بعد العزل حصل على شهاده من الكواليتي قبل كده من the best department in the hospital. With the time of the patient, they but still they are caring very well. Thank you.
CCU سليمان علي كعبي.
Sulaiman, the one handling now CCU, the critical area.
CTM جابر معيدي. الأطفال سوسن محمد حمدي. بدي ICU فاطمة حسن محزري.
أنا بدي مجهود على السايلنت يعني.
العيادات أفراح سعد ضامري. ER أنجمول. دايابيتك سنتر نورة حلطاني.
وسوبر فايبر عملت معنا وعلى بعد المشوار حقه بس ما شاء الله دايناميك سنتر. نعم ما يحتاج الاولد ستاف حقنا.
تقدير احمد محمد عبيري.
هذول الناس اللي جوا الغوار يعني.
هذول الناس اللي ما حد يدري عنهم بس جوا شباب.
نعم بس يبغون ظاهرين لنا. هذا من اولاد جبريل يعني.
انا اشهد له على الله يوفقك. هذا من أمر الكفاءة.
Nursing service, the best coordinator ever, Sister Ami Torres.
هذه شغالة عليه النهار أي وقت سكرتيرة يعني ما عندها.
I want her to be my secretary.
دكتور ابتسام محمد عاشوري. فيما نفرو نداء عطية مشيري.
نداء مع حالات العسكر وانتم عارفين يعني
الغسيل نساء نور احمد الصديق.
الحالات اللي تحول يعني دائما
الغسيل رجال ميل دايليسيس انجيو فيتور. العمليات محمد محسن علي. اندوسكوبي اريكا منديس. and recovery جنيتا ماريا.
العدد من عيال جبريل يعني.
أخيرا هدية من إدارة التمريض والعلاقات العامة للدكتور حسن شابي.
موسى دكتور حسن السباك قال مغلف احسن.
ايوه
ما حد يدري والله.
احيانا يطلع
الله يوفقكم ان شاء الله.
شكرا دكتور حسن وجبريل والاستاذ موسى وعبد الرحمن.
السلام عليكم.
البرنامج Okay. Again, we'll continue the second lecture. It's about Sbar. If you see, I give you in the folder, I give you this paper, right? Okay. This. Okay. This one I give you. It will help you how to conduct Sbar. It is not something you have to do it, but it is basics, and it is if you see like S, there is so many information there, B for so many information, A so many information, so you don't have to keep it and memorize it all. We'll just show you how to do it easily and directly. Again, for our King Fahd Hospital, we have competency for Sbar, and which we will apply. And all of you from different hospitals, you will have it at the end of the day. Okay, wait, Majid, I will just give you 1 minute scenario, and then we'll continue. Bizaline. Bizaline. Okay. Okay, I'll just give you a scenario. Imagine he's the patient and Zalin is the nurse. Just sit down anywhere and then call. You just sit here. Okay, he's the patient and he's lying down in the bed. But here we have, and by the way, the scenario only imaginary. From my mind, it is not true. Absolutely not true.
Sister, أنا في تعبان.
Allah, so happy time.
Sister, أنا موت.
أيوة بابا دقيقة أنا مشغول.
أنا تعبان. في كتمة.
She's coming from the door, and then
أيوة بابا أنا خلم دكتور دقيقة.
okay, this is the first scenario. I want you to think what you have done. Is it right? Is it wrong? And then you call your doctor.
Hello, Dr. Jean.
Yes.
Can you come here in female surgery?
Yes, sister. I am busy now in ER. Female surgery. Okay, yes, I am busy now in ER. I will be coming after I finish my patient. Okay?
Doctor, he is complaining a lot. I am so busy.
No problem, sister. You just manage until I will come.
Okay.
Finish. This is the first scenario. Come, we'll continue the second one.
Okay.
انت خلاص روح. Okay, the second scenario, just few seconds. Again, you see whatever problems are there, keep it in your mind. See how we will solve it at the end of this lecture, inshallah. I am the coming shift. Coming in the morning and she's night. Yes, how are you today?
Oh, we are so busy. We have so patients and all complaining.
Okay, no problem. This always we are like this and we have so many patients and we are only two in the shift, so it's okay.
Okay, but there's nothing special. All the same.
Okay. Any admission?
No, no.
Sister, what do you have done in that room? Anything like you did today for me or not yet?
No, still. Doctor is coming to see the patient.
Okay, this is endorsement. And the first one, it was just how she will call the doctor. How she is preparing, like doing the assessment. Okay, we'll not talk about it right now. I will just ask you only, how are you doing your endorsement? How are you doing your referral to a doctor? How are you calling your doctor? So, anybody can answer me? Even from our hospital. How you are doing? Isa, كيف تتصل على الدكتور? How are you calling your doctor? When you are referring a case to him, and you are in ortho, you have long-term patients and they are with fractures. Tell me the honest, like, okay, what you are doing. Okay. 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 Sultan, medical, how you are doing it?
So we will do assessment for the patient first. After that we will put them they can help you.
You attend the lecture already. Smart. Okay, we'll not just go through it and you think about your hospital and how you are doing the preparing to a doctor, how you are doing endorsement. So not go through all the hospitals, we'll just step by step. So, when you are calling your doctor, remember, when you will talk to him, you will lose his attention in 10 seconds. This is by research. It is not something I said. If you will not give the exact and important information within 10 seconds, you will lose his attention. He will not listen to you anymore. Whatever you will talk, oh doctor, we are very busy, please come and see the patient. And we are really having so many, 25 patients, and I have so many papers to finish. So why you should tell all this information? He don't need it. يعني الدكتور يحتاج معلومات معينة عن المريض بالذات. علشان كده لما تتكلم عن أشياء ما لها لزوم يصير الدكتور خلاص will not get the attention to you. Nurses are less likely to communicate when they feel unsafe. We agree. Some doctors, some other supervisors, when you talk to them, they will always shout, or maybe it's their nature. Maybe they are not shouting, but it's their nature how they will communicate with you. You will feel afraid. So you will not be able, or you don't like to call them for your patient. Therefore, your care to your patient will not be a good care. يعني اذا اتصلنا الدكتور او احنا نكون خايفين من الدكتور او من السوبرفايزر او whatever، ما راح نقدر نعطي المعلومات، ما راح نقدر نرعى المريض رعايه صحيحه. If you are not aware about your patient, if you are not fully aware about the cases you have, now if you will go and receive the endorsement, you have to ask about all the information related to your patient. But if you are not aware, then you will be calling your doctor. What information you are going to give? The doctors, of course, they are going to ask you certain questions you will not be able to answer. So the communication will have, we will have miscommunication. So what can we do? Improve the communication skills. So when we say, and you know, sometimes or many people, they don't believe like that nurses we are up to the standards. And if you think some departments, they are underestimating you, or they are thinking you are not professional, and we started to do our work as only routine, we are not professional department, then we cannot do anything. But you have to tell them that we are professional, we can do it. How will you do that? It's not by fighting, it's not you are going to fight with them, yes I am professional, I know my work, no, it's not the way. When we are doing our work in professional way, like for example, when you call your doctor, doctor, this patient is stable. Is this the answer? But if you will tell the doctor, hemodynamically stable. So, you see the difference? You are talking professional. So the doctor will think, okay, I have good nurse with me. So they will feel comfortable, they will take good information from you, then they will respect. So that's what we are going to do. It is JCI updates. This Sbar and organized tool of communication. Next JCI standard, we have to have certain one. And we agree, nursing service, that we will use Sbar and with hospital administration agreement. This communication tool shall be used in all hospital communication. So we start in nursing and we wanted to do it properly with nurses, and it will take for us like few months to do it perfectly, and we'll overcome our problems and difficulties. Sbar is for the situation, B for background information, A for assessment, R for recommendation. Okay. For situation, in some places they call it I-Sbar. I is for the identification and S for the situation. For us here in King Fahd Hospital, we will be using S for the identification and the situation. Okay, for example, ortho department, you have patient with fractured femur, and then patient is complaining of pain. And if you remember in my previous lecture, which it was last month, about the assessment, and how will you do pain assessment and reassessment. Remember? I said first, you have to go and check your patient. And when you do check for your patient, you do the assessment. You ask your patient, do the assessment, what is the severity of the pain, quality, and the location of pain. And then you see medication sheet. Maybe there are some medication PRN. So you will start do non-pharmacological, then pharmacological, and then if there is a problem still there, you have to call your doctor. So you reach to a point that you have to call your doctor. What you will say to your doctor? The situation. Doctor, I am Shawki, I am calling you from Male Ortho, and I am calling you about this patient Muhammad Ahmad Ali with record number 12345, and the situation is that patient is complaining of severe pain in his right femur, for example, and then I assist. Before you go for the assessment, and you have to tell, you will go for the background information. What is the background information? Patient came with RTA and vital signs. Is vital signs important now? Is it important? هل هي مهمة أن نأخذ vital signs? Okay, then you have to include the vital signs. Then you tell the doctor the vital signs. Then you just, what you did the assessment? Pain score, you did the pain score, and then it was, for example, 9 out of 10. Then you will ask the doctor, what do you recommend? Okay, if you are confident, it's not only about pain, with other situations, you can give a recommendation. Doctor, do you want me to do like this? For example, patient is diabetic, and when you did random blood sugar, it was 30 milligram. And then, doctor, do you want me to start dextrose 50%? Doctor, do you want me to start dextrose 10% until you come? Okay, this is a recommendation. Although, remember, it is not allowed to give any high alert medication unless the doctor is there. So we should not accept. So we can just find some solution. Maybe there is some protocols for this hypoglycemic patient. Okay? So after you finish the background information, you did the assessment, then the doctor will tell you, okay, you give, for example, Voltaren. You give, for example, morphine, betadine, or whatever. So the doctor give you the medication to be given. So this is very easy. And when we will start implementing this one, it will take us maybe 10 minutes or 15 minutes to understand and to be confident. But next time, when we are practicing this one very well, we will do it in 1 minute. It will be done only in 1 minute or less. And also the endorsement. The study shows after you are very well practicing this Sbar, you will be doing for each patient only 1 minute. At the beginning, maybe you need long time to do the endorsement, but after you do it very well, you will have only 1 minute. So we will reduce the time you are spending to give the endorsement in the morning or evening or night. It is used to facilitate appropriate communication nurse to nurse or nurse to a doctor. So this is the main reason why we are using Sbar, just to make communication organized, easy, and to give the chance for either the other person receiving from you, either a doctor or a nurse, to ask you further questions. It allows short, organized, and predictable flow of information. And it will be easy. And I know, for example, I'm receiving from you, and then I know what you are going to tell me next. So if you will miss, and sometimes, as you saw it when we're doing the scenario, she's going home already, and I'm calling her sister. Have you done like this, like that? So I remember she's already going home. But if we have organized tool, that's the time while she's doing the endorsement to me, that's the time I will tell her, okay sister, have you done like this? So I will give the opportunity to ask more questions and to ask better questions. So we know what have been done or what have not been done to the patient. Okay? What are the difficulties we are expected to see when we are implementing this one? Yes? Yes, this is the difficulties of communication. Yes, when they are shy or they feel like, okay, I don't know English, I cannot speak very well, so I just give this one. This is one of the problems of communication. This problem, effective communication, is the language. If they are not aware like that. If I'm familiar with the concept, if we are not familiar with this idea, that's why we started 2 days ago to give these lectures for our hospital staff here, just to make them aware. It's just the introduction. It is not the end. It's not only lecture and let them practice. It cannot be like that. So we have to make them absorb the idea. The most important to understand why are we doing this one. And the same what we are doing to you from different hospitals, to get this information, think about it. If you think it is applicable to your hospital, just organize with regional nursing office, ask him, Brother Musa, Sister Fauzia there, because Fauzia, she knows about this one. So she will do it for you in the hospital and we can organize that one. If not educated and practiced well. So if there is no education or not practiced well, there will never be good implementation. So what we have to do in our hospital, we have CRN. As all of you know, in the department, you have CRN. Their job is to facilitate, to educate, to stay with you, to practice, and to also to call a doctor for some situations. They will call and they will show you how you are doing it. And I will be following up with all the CRN. I will teaching the CRN on how to do it properly, and I will be with them. So they will be with you. And if overall we have a problem and they cannot solve it, we will find someone else who can help us. So it is long process, but we make it at the end, inshallah. If there is no follow-up, again, that's what we are doing. That's what we are going to do, the follow-up by the CRN in the departments, nursing education. That's what we are going to do. If there is no good leader to support, and alhamdulillah, we have good leaders in the hospital, administration, nursing services, and you have your charge nurses, and also the leader, the CRN, supervisors. So we have organization. Using R as recommendation, yes, we understand some nurses, they are afraid or they feel, no, this is scary to give a doctor recommendation. That's why. When we are practicing this one, the studies shows that it is applicable. If you say, so doctor, what do you want me to do? So it is okay. But the most important for this one, and the previous lecture, it is how you do assessment. You reach to a point that you did good assessment for your patient. This is the most important and effective. When you do good assessment, that means you are going to give good care. But if we don't do good assessment, we will not do good care. Remember, and I am sure, you know, you do assessment, but sometimes we are not aware that's what we are doing. When I said you are going to your patient to the department when they are to the room, when they call you sister, Ana fi Ana. Okay, don't answer the patient. You are sitting in the counter because this is not good nursing. Go to your patient. I know you are busy. You are with shortage of nurses again. So you still have to go and see your patient. Because maybe the patient is calling you, they are already on the floor. Maybe they fell down. So you have to do assessment. The time you are just going to see your patient, it is assessment. Then you need to do maybe vital signs. Maybe you need to do other things before calling your doctor. So always remember, don't answer the patient just while you are sitting at the counter. So do the assessment. Go there to your room, to the patient's side, look to the patient. So the situation, identify yourself, department, patient record number, and treating physician. What is the situation or problem? What is the diagnosis of your patient? If related to the surgery, use surgery site. You mention the surgery. What kind of surgery being done for the patient? Background information. What is the patient's complaint? If, for example, pain, when you call, give full information about your patient's pain. So you give the location, the quality of pain. So you have to give enough and good information. And if there is, for example, medication reaction, you are calling the doctor because of medication reaction, blood reaction, then you have to call the doctor, inform the doctor properly the information. Remember, you give information only related to the recent complaint. Okay, you have chronic patient. When you give call for your doctor, you give the information, background information and the situation. You don't have to mention everything done for the patient. No, just whatever related to the situation you are calling now. So make it short and precise. Assessment, what's your assessment of the situation? What did you do when your patients complain? Did you check for the sign or any signs and symptoms? Then, what was your finding? When you did your finding, then you go to the doctor, inform him. Recommendation, what's your recommendation to solve the situation? Do you need to request any further test to be done? Any pending test may help to resolve the problem and what to do. So you can recommend things also. Remember, if you have no recommendation, do not be afraid to say to your doctor that you have no recommendation. Response, this one only additional and it's optional. Again, if you have done any action or intervention for your patient, then write a response. Otherwise, you don't have to. Why we do it? Because clear and more concise report, full information, timely fashion, patient safety. This is most important. What we are doing with our patient, always we have to ensure patient safety. This is the reason we have to do organized means of communication to improve the safety of the patient. So we will not forget when we do endorsement, we will not forget things when we give information to the doctor. So we are considering patient safety by giving enough information. Better patient assessment and management. So if you do this one, plus the previous one, you will do better assessment. You will learn. every time you do assessment for new things, believe me, you will learn something new. Then you will feel more confident. You will feel that you can do it. I know we have some problems with the nurses. They are not coming for duty, not because they want to be absent. They are afraid in some situations. They are not aware what we have in the department. So when you are learning by yourself or by any means, so you will be confident, and I'm sure you will stop being absent. The policy, you will have a copy of the policy in the thing we are going to give you at the end of the day. Provide accurate information, framework. It shall be used in this situation, shift changing, transfer of patient from any department for any procedure, like for example, you are taking patients from your department to a CT scan. So you will endorse the CT scan staff. If you are doing for MRI, so you have to inform the nurses there what you have done, you do it properly. The worksheet, the one you have in your folder, it is worksheet which will be given to the departments later on here when we implement it. At the end, it will be blank. So that's the worksheet. Every nurse is expected to follow the policy worksheet to be used for 1 year. So actually, this endorsement and the call for a doctor, we should not use specific form. We will not do printing. But for the first year, inshallah, we are planning for our hospital to use it for all this 1437 until the end, and then we will not use it because it will be practiced without using to have to write all the information, just for the reinforcement. All nurses shall attend any training program to be able to improve their knowledge and abilities. And that's it. Any question? أي أسئلة؟ Okay. تفضل.
This is an excellent, actually, program you are going to run in the hospital and maybe other hospitals. It is really for good safety of patients at the end. And the scenario we saw, the patient was complaining of kidney, and the nurse was hesitating, maybe she was busy or so. And we have some nurses, as you said, they are afraid of talking even to the doctor. And I think if we follow this program, it will be excellent. I agree, it will take time for the idea to be absorbed and then to be practiced. Putting the form is okay, but I feel we have a lot of burden on the nurses by writing. Make it as short as possible. It is only to remind the people what they should do. I know. For 1 year, then you will delete this paper. No more. No need. No more. If you try to make it as short as possible, so it will not be difficult for the nurses.
Okay. Dr. Hassan is right. If you see this form I give you, for example, the B, it's background information. When for us in Infant Hospital, when we practice, we are going to remove all this one. I will give blank. But this one, why we give now? Just for them to understand only. So when we apply it in the hospital, there will not be any information here. So we will teach you within first 3 months that every information you put here, it's up to you, which is not up to you what you want to do, but it's up to you to understand that it is what relevant to the situation only. So you don't have to write everything, you have to write only specific information which is needed, and the doctor will not. And maybe the doctor will ask you further question. Even what's written here, it's not enough. Maybe they will ask more questions, so they will understand. Okay. Okay, shukran. Yeah, Azim.
This will come to the mind. Most of the nurses here in this world that is Sbar. Actually, we want you to tell when and in which situation they can apply this Sbar.
Anytime they are going to call the doctor to refer a case, they will call the doctor for any problem. They will use this tool or this way of communication. And in the future, after this first year, inshallah, we'll start to do how they will endorse. Morning shift to the evening, evening to the night, night to the morning. They will use this one. And by practice, when they are confident to the practice, they will do it perfectly, inshallah. It is break time, by the way.
Thank you.
Thank you so much. And if you come on time, we will leave, inshallah, earlier than the time.